Yeah. Good evening, ladies and gentlemen. My name is Kumbira Ichpadza. Welcome to another episode of Afrolynk ExpertLive. Tonight, we have two experts, and I'm happy to say we have changed the way we have been doing things. We are now looking at saying how prepared is Africa for COVID-19. And in the house today, we have the CEO and co-founder of BezoMoney from Nigeria, Mubarak Sumaila. Mubarak, welcome to the show.
Thank you. Thank you, Kumbara.
Okay. You're welcome. We seem to have lost Ihani Chuku from eHealth. Hopefully you'll be back with us very soon. So I think we might start. We can might as well go on. Hopefully you will join us in a moment. Yeah, Mubarak. In this time, thank you, Ihani Chuku. You're back.
Yes, I am.
Thank you very much. Thank you very much. So this is Ihani Chuku Uzoma. He's the programs manager for eHealth Africa, and he's joining us live from Nigeria, while Mubarak Sumaila is joining us from Ghana. Thank you, gentlemen, for being on the Expert Live tonight with us. I would like to start with you, Mubarak. Maybe you could just give us a brief in terms of what is BezoMoney and what do you guys do?
Okay. So my name is Mubarak Sumaila. I'm the CEO and co-founder of BezoMoney. BezoMoney is a digital savings platform that is built for people in the informal sector. So what we basically do is to help people save through mobile money technology, and then to use the savings history out of their savings to give them access to credit. So we actually focus mainly on savings groups, and if you're familiar with them, in Ghana they are called Susu groups. In Kenya they are called Chama. In South Africa they are called Stokvels. They are actually widespread across many developing countries. So we focus mainly on those savings groups. We help to digitize their activities, help them save, and then also give them access to other services. So that's what we do in a nutshell. Okay. Yes.
Thank you. I'm from Southern Africa, so I understand the Stokvels more than yeah. Yeah. So then, when was BezoMoney formed, and at what stage are you now in terms of your business?
Okay, so we actually started operation sometime last year. We're actually a portfolio company of the Meltwater Entrepreneur School of Technology incubator. So we went through the MEST training program, and then secured seed funding, $100,000 from MEST to start a business. And from the time we actually did market research for about a year and a half before actually going out with the product. So we did a deep dive into the savings space, the informal sector space, to find out what really existed, what players were already in the market, and then what we can do to help. I think one striking thing that we found was that there was a huge chunk of money and a huge chunk of people within the country and then within Africa who are still saving money informally. And because of how banks are built or how banks are actually structured, this money doesn't actually reach them. And also these people don't get a way to be able to improve their lives. So they keep doing this, year in, year out, and then they don't improve their socio economic status, right? Even though they save huge sums of money. So I think that was really striking. We found out that there was around 430 million people across Africa that are actually saving within these savings groups, and they are saving about $201 billion each year. And they are doing this by keeping the money inside boxes. Some even keep the money under their mattresses, right? So our aim was to go in and to find out what was really happening and why that was happening. I mean, just like I mentioned before about the banks, the bank products are not built with such people in mind. Their processes are very formalized. There's paperwork everywhere. A lot of these people in the informal sector can't necessarily read and write, and so when they go to the banks, they're not able to fill in all of those paperwork, and usually a lot of them also feel kind of uncomfortable when they go inside such formal environments with people dressed in suits. So they would rather deal with themselves, people they are quite familiar with. So that's why they actually save with their friends in those savings groups. So they keep this money, they put the money together either each week, each day, or each month, keep the money in a box or give the money to one person. And then that person is able to use that money to, pay for the fees of their kids, or invest the money in their businesses, or pay for healthcare. So what we saw was that, number one, it wasn't safe how the money was being kept because it was in a box. And then the number two thing was that the money was sometimes mismanaged because it was, the whole process was based on a human factor. And I think the most important thing for us was the fact that it's a form of credit that they take from the group and pay back. And so we realized that the growing demand for credit wasn't met by the amount of money that the group was actually contributing. So in essence, when they needed to take money from a financial institution like a bank, it wasn't possible for them to go to the banks, for anything. So we realized that we had to do something, and something that was in line with whatever they are doing currently, something that doesn't change the structure. This savings group scheme has been around for centuries. It's something that, I think it's in almost every country. It's in the US. Like a lot of the immigrant groups that travel to the States, when they get there, they are not able to get access to the banks. So they form savings groups and use the money to actually start businesses. So it's like it's an intuitive thing that people have been doing for a very long time, right? And it's so surprising that banks have not actually built something on top of this, right? So we basically came in to digitize the work that is happening, to make sure that the transactions are occurring digitally, and then to also make sure that there's record of every transaction. And the most important thing is to use the transaction to be able to come up with a history, and be able to use that history to give them access to services. For now, we're looking at credit, but we intend to look at other group savings products like group insurance, group investment, group pensions. Right. So that is how it is. And the way it works is that it's actually connected to mobile money. So we did that very intentionally because mobile money is very known. It's widely known across Ghana and across Africa. So we decided to build on top of that to make sure that they are very familiar with how the thing works.
Okay. Thank you for that detailed explanation. It's very interesting. You talk about figures of 430 million people across Africa and 200 billion that they are trading in this informal sector. So this is quite a big market. I just want to say a shout out to Kibiti Mayelo, I think from South Africa, Rapula Motivane from Brits in South Africa. I'm sure they are very well versed with the stock bells. I also see Lonia Matinya, she's from Nairobi, and Patrick Maseko, he's into fintech. I know they are running an old mutual hub in Zimbabwe, so he's very interested in what we are talking about as well. There's also John Akuoko Taiwa in Ghana. He's got a question. Maybe I'll get the question to you later on, but if you can see it, you can also write it down. And Masimba watching from Amsterdam. Yeah. Iani Chuku, we had lost you once again, but we are happy that we have you back on the line. To kick off from your end, can you tell us a bit in terms of what is eHealth Africa and what are you guys into?
Okay, thank you, Kumbi. eHealth Africa is actually a technology-driven organization. Actually started up in 2009 with a simple idea to have community in developing countries access better healthcare when providers are able to make data-driven decisions. So in simple terms, we tried to convert manual processes to electronic processes to help decision makers have data electronically and make decisions quickly all geared towards improving the health systems in Nigeria. We have for a while now supported the polio eradication initiative in Nigeria, and hopefully, maybe if not for the coronavirus pandemic, at this moment we should be preparing to celebrate Nigeria being polio free. So we've done a lot of electronic enabled services, especially around geographic information systems, and a whole lot around data services for logistics management, vaccine delivery, and a couple of other things. So simply making processes better for decision making.
Okay, thank you for that. My next question would be to you again, Yanichuku. In terms of we're talking about is Africa, how Africa is prepared in terms of the COVID-19. My question would be, as eHealth, what do you use to gauge in terms of the disaster preparedness? Yeah, maybe you can give us more on that one.
Okay. Normally, when you're looking at the preparedness for a response to epidemic or emergencies, you'd want to look at the systems in place. You want to look at available data. You want to look at facilities. You want to look at policies in place. You want to look at logistics and a couple of other mechanisms that should be able to allow a country or an organization or a system respond to emergencies. And I think looking at Africa, looking at Nigeria, the whole emergency response to the polio eradication initiative, I think prepared a bit of the ground for us with respect to logistics, human resources, a bit of system, health system enablement. I also believe the response to Ebola was also more or less like a preparatory step for Africa generally. So I think that when you look at these parameters, we're not exactly very unprepared. We probably had a few systems we could easily piggyback on to begin to respond to this pandemic. So the question will actually be how well we are using the existing systems to respond to the current pandemic.
Okay, I'll get to that one. That's the interesting part. Back to you, Mubarak. I want now for you to be practical with us. What is BezoMoney doing in this current situation as a solution? Yes.
Yeah. So actually, the product itself, goes in line with the various solutions that are needed during these times. The informal sector or the underserved and underdeveloped sort of groups are actually the ones that have been affected the most as a result of this current pandemic. So in Ghana, for instance, we had a lockdown for a period of time, and then during this time, these people were not able to go to they are mostly market women, farmers, basically traders. So during this time, they were not able to go out and sell, and as a result of all of this, they couldn't have money to fend for themselves and also to fend for their families. So whatever happened helped make an impression on them that it's actually very important to take savings very seriously. It's not something that you do on and off. It should be something that you should consciously do. And then I think the other thing is we also built a crowdfunding platform, and our aim was to raise $10,000 and use this to provide working capital for the market women. And we're also working with various partners to put together a crowdfunding platform that can help them to be able to raise money. So basically, during or after the COVID, let's assume you are a market woman or you are a farmer who needs capital to invest in your business. You can be profiled and then sort of featured on the platform, and then people can sort of donate money to you. The money can come in the form of a loan or in the form of equity. Or in the form of a grant. So I think those are the main things that we're actually looking at. For the crowdfunding, we're doing this in collaboration with the AHK. It's the German, the delegation of the German industry in Ghana, and also some few other partners that we're yet to confirm.
Okay, thank you very much. To anyone out there who might be interested in this crowdfunding initiative to help our informal mothers and sisters. This is one opportunity. I mean, we also have one organization is out of South Africa that are doing something similar to what you're doing, and we can also be able to connect you guys in this noble gesture. Thank you, Mubarak, for that. Back to you, Yani Chuku. We are about to go into the practicality of the steps and the solutions that you guys are doing on the ground. To the main question, how is data and technology being used in this pandemic?
Okay. I think one of the things that going back to what I mentioned in my previous response, one of the things that actually helped Nigeria, in particular, has been the structure that was in place for the polio response. So all across the country, we had emergency operation centers for polio, largely in many states. You have that. Some other states had the public emergency operation centers. Now, these centers largely work with data we get from the field. Previously, while working on the polio emergency response, we have used Android devices to manage tracking of vaccination teams in the field. This helped us to ensure that people actually go out there to carry vaccination activities, and we know where they go to. So what did we do in this kind of scenario? We could actually have stopped to using enabled paper forms to collect data, but we wanted to go one step ahead to look at how we can ensure that the cases that are being traced, the contacts that are being traced, we know their geolocations, we can map them out, we can use that data to look at where the cases are actually emanating from, and also manage the contact tracing for that. So our major support for now has been to the Nigerian CDC, Center for Disease Control, where we have installed an auto contact system. Actually was supposed to work most effectively with tracking of travelers coming into the country. So their contacts are actually stored. When for any reason one of them is tested positive, the system automatically reaches out to every other person on that contact tree and gives them the information and requests them to present themselves for testing, or if they have symptoms, they should actually present themselves to the designated health facilities. Now we had installed that, and we are actually looking at how also using that for contact tracing for persons that have been identified as contacts, at least to do the symptom daily symptom tracking for these persons. Now you would see how important that is when you're looking at the large number of persons you need to reach out to when you're doing contact tracing, and the drought we have with health workers in the field, so actually go to each of these contacts. So that system is one that would actually help us a lot with the contact tracing. We also working with CDC on the system they had actually deployed. It's actually called the Surveillance Outbreak Response Management and Analysis System, SOMAS. It was deployed for the response to Lassa fever, and that is a system that actually gathers data for the Nigerian CDC. So every state has a SOMAS representative that collates the data from the field, and that data we analyze and synthesize down here at the NCDC headquarters, and we push that data to the microsite that we manage on behalf of the NCDC. So that's the covid19.ncdc.ng. So that's it's also something we do. So tracking that data on a daily basis and actually having people informed on that side is what we also do. We have also tried on the ground to support a few states around some investigations being done for this COVID-19 cases. Some I may not be able to give us full details for now because of confidentiality issues around the support we present, but we've supported in investigating death cases to find out if they're actually due to COVID-19 or not. One of the other key areas that we have applied data and technology is the distribution of commodities. So you have donors bringing in PPEs, you have donors bringing in drugs and the rest of this. So you have to distribute this to different parts of the country. So we implemented a logistic management information system for the NCDC that helps track these commodities, help track where they are delivered to, and help track the stock that they have in those different locations. This way, we're able to manage equitable distribution of these commodities to the different places where they are needed. A few other things we try to do is to also manage geospatial components for what the NCDC does. I've already explained the use of the GIS. So this way we try to also map out the locations where these cases are reported from and try our best to manage them. Two other areas we provide support to the NCDC is the area of awareness. Now, one of the things you would notice with the pandemic response is information out there, a lot of negative information, a lot of misinformation. So we try to put up an e-learning platform where we had made videos, audio visuals on how to use PPEs, on the information about how to be safe there as a health worker especially. This is targeted mainly for health workers. And that is also something we have done for the NCDC to be sure that people have the right information and can actually use this information to keep themselves safe as much as possible during this pandemic. The final thing we're doing is to support the NCDC research team using digital methods. So we converted the first few cases response form, standard forms that WHO published into digital forms, and the research team would want to use this form to investigate the first few cases and try to use that data to plan effective response during this process, and maybe help us also prepare in future for any such responses. Those data will actually also be used for laboratory research. Yeah, let me stop there for now.
Thank you very much. I was getting into the groove of the health system. I'm happy that you went further from health to show how data and technology is also being used in terms of logistics, distribution, as well as e-learning. I mean, as Afrolynk, we are also trying to focus on the post-COVID side, to say post-COVID, we believe that is going to be the big five. And the big five is health, agriculture, logistics, Fintech, and digitalization / e-learning. And you mentioned a lot about that. Before I go to you, Mbarak, I just want to get back to our viewers watching. Sven Mangels from Hamburg. Hi, Sven. How are you? Hope you're good. Moses watching from Berlin. James in Ghana. Obadimolola in Berlin. We have Habib Fazli. He says, that's a great initiative. I recommend a platform for this eHealth. That's Tech for Life Enterprises Canada. Their product name is MD Consults. It's a software. Easteth Sojo is a hardware. So maybe it's something that we can also look at afterwards. That's from Habib Fazli. And Kibiti says technology is key in dealing with the life beyond COVID. Definitely, technology is key. And this is why our primary focus to say post-COVID. Before we go post-COVID, still in the COVID situation, but from your end, okay, John has got a question that hasn't been answered. I think as you answer John's question, he says, what are the regulatory hurdles that BezoMoney faces in Ghana? Before you answer that, I'll then want you to proceed from his question to also then tell us, we want now to join what has been said by Ihani Chuku in terms of the opportunities as well that you see and the collaborations that you see in the different sectors in terms of data and technology. Yeah, so please go ahead, start with John's question. Sorry, John, for forgetting you for a second.
All right, John, thanks so much for the question. I think so far Ghana has been very helpful. The Bank of Ghana has been very helpful when it comes to fintech companies and then the digitization of the economy, the financial system. They introduced something called the GIPS. So the system basically helps you to transfer money from various mobile money platforms to other mobile money platforms on different networks. So that, and also help you to also send money to banks from your mobile money wallets. So they've been very instrumental in syncing the various aspects of the financial technology platforms that are being built or that are coming up. They've also introduced something called the Payment Systems Act. So it's basically a set of regulations that has been put together to regulate the various fintech companies that are in the country. And just recently, I think just this week, we got word that they've opened up a new office. It's actually a fintech office for the various fintech platforms in the country. So according to the Payment Systems Act, certain payments systems that are doing certain things need to have some minimum capital, and some also don't. If your platform is a basic payments platform, then you don't need to have any sort of minimum capital. But when you are processing people's money, and when you are also running a mobile money platform, you need to have that minimum capital to get a license. For us, the thing that has helped us is that we're not actually holding the customer deposits. This is being kept by the banks. And the other thing too is that we are leveraging on top of the existing mobile money platforms. So I'd like to describe our user journey a bit, so you get a very good picture of this. So what happens is that the user first of all signs up by uploading various documents and also entering various details. And after that, we connect their BezoMoney account to their mobile money account and also create an account at the bank in the user's name. So the next thing the user does is to go and create a savings goal, either themselves or together with their group. So at any point in time, money moves between the user's mobile money wallet into the bank account or vice versa. So in essence, we don't actually hold the money and we don't touch the money. The money is being moved into various accounts, and this movement is being facilitated by payment aggregators and also payment processors. So that has helped us a lot in being able to speak to the regulator. We are yet to actually get a license, but we're actually getting there. In terms of the opportunities or the various collaborations that could result as a result of this COVID crisis, I think in the fintech space, just like I was saying before, people are beginning to see the essence of actually saving and taking savings very seriously. So it's made a very deep impression on the informal sector, which represents a large part of the like economy that we have here in Africa. So once they save very properly and also save using the right means, they'll be able to get access to other services. And one thing that we think stands out about our product is that we're actually giving people true financial inclusion, right? We're actually giving them access to accounts that are at banks, right? It's one thing to use your mobile money wallet to conduct various transactions, and it's another thing to have a bank account. There are certain benefits you can enjoy when you have an account with the bank that you'll not be able to get if you are using a mobile money wallet. So we are kind of like sort of, we're not happy, but we are kind of like, sort of pleased that people are beginning to see the essence, and like I was saying, especially the informal sector. And the other thing is the insurance industry. So we are also beginning to see that trend. People are beginning to see the need to actually insure themselves. In terms of life insurance, health insurance, these things are very important. So people are beginning to see these things. Back to the savings and also the banking industry. When during these lockdowns, I believe South Africa is still in lockdown. During our lockdown period in Ghana, people couldn't go to the banks to deposit money or to take money out of their accounts. So the banks started seeing that it's actually very important to have agency bankers or mobile bankers, right? There are people at home in their rooms who want to have access to their accounts, right? And then if there are some people that might not be able to use their apps for anything. So if they can't just step outside their homes and do the transaction in front of their house, it becomes very difficult for them to actually get access to money. So I think that it's kind of a wake-up call to the banks. They are beginning to see is that they actually need to get into the digitization of some of their services. And I think we are also well positioned. The fintech companies that are doing things that banks could leverage off of, we are well positioned to help them to actually achieve their aims And usually it makes more sense to them to partner with a third party to do certain things than building out their own infrastructure. Yeah. So when it comes to the opportunities in the fintech space, I would say savings and insurance, and also a bit of investments, because people need to be able to prepare themselves in case anything like this happens again.
I think what the interesting part is that banks come from a certain side, from a certain culture, and what you are doing is coming from a certain culture. So if Africa could do more of our own culture, our own traditions, and make money out of that. I mean, you talk about 430 million people with 200 billion. Yeah. So maybe the banks, because sometimes the banks might end up chewing you up into the banking system. But already what you're doing, you're already a bank itself. So I think sometimes we need, as Africans, we also need to find local solutions to our problems that also bring value to our people, like what you're already doing. Thank you very much for that. Yani Chuku, I'd like now to proceed in terms of, you talked about it in brief as well, but the eHealth Academy, I know we have a lot of young people who are also watching, who might also be interested in terms of also doing these emerging technologies like your data science and the like. Please tell us a bit about the eHealth Academy.
Okay. So one of the things that we have tried to promote as much as possible is sustenance of everything we push out there in the field, capacity building, as well as capability building across the different private and government organizations we've worked with. So one of the initiatives we launched sometime last year was to get a cohort of young persons interested in web design. We started with web design, and have them go through a period of courses in our campus in Kano, then had them do a few practical tips. So that's something we intend to continue to give opportunities to young people that want to come into the technology space. So we would do that for data management, we do that for data analysis, we do that for geographic information system analysis, and a whole range of things that we'll hope to do. While our mainstay is around health systems, like I mentioned, we're also looking at improvement in logistics management, even though largely around the health sector. But then we also would be able to push that to agriculture and to other possible core areas. The last thing we also try to do is for every program we package for state governments, for agencies, we ensure that there's a capacity building model. Now, one of the things that we've tried to change in the mindset of people is, oh, technology is so difficult. It's not as difficult as we imagine if you actually have people see how simple it could be. I think one of the things that this pandemic and lockdown has helped people understand is we're actually closer to technology than we actually know, or we actually had believed before. And people wouldn't have believed they could actually pick up their phone and talk to a doctor through telemedicine and get good advice. But we have guys now developing apps to support telemedicine. You have people developing apps to help people check their symptoms on a daily basis and help them actually find out whether they need to report themselves to the next testing center or not. So those are capacities that we will try to build. We are still working on that strategy, and we're trying our best to see how we can expand it to different parts of Nigeria and every other country where we have presence. So it's a core value for us to build capacity and to expand that capacity across young startups, young people, and government agencies, actually.
Okay, thank you very much. So to any young people who are watching, later on, you can also tell us the countries that eHealth is currently operating in. But I also think that because of digitalization on these online platforms, you must be more inclusive across Africa, because what you guys are doing is very important for African people. Thank you. I want to go to the questions. There are now a lot of questions that are coming up. So let's go to the questions from our viewers. Firstly, Larry Cool, Larry, thank you for joining in. Sbangajo, thank you for coming through. Farai Chabavan de Bogat, thank you. Sem Tsima, our partner from Kometsa, he's always there. Thank you for watching from South Africa. there was something about Stockville's that was mentioned earlier on. I would like to go to their questions now. That Kibiti has a question, says, what cybersecurity measures are being taken into account since there's great utilization of technologies? I think this applies to both of you, but maybe more, we can start from your end, Barak. We can't hear you. Hello? We can't hear you.
I think my mic was on
Yeah,
mute.
now we can hear you. Okay.
I think what we're making sure of is that we're using partners that are trusted and that are also being used by banks and also mobile money sort of operators. So we're sort of ensuring that the money that is going through the system is well protected, and we're also making sure that the KYC processes that we're using are very very strong. So we take we take your ID number, we take a picture of your ID, we take a picture of you holding your ID. So we make sure that the KYC process is quite stringent. So we stop people who are who sort of have the intention of coming on the platform to defraud people from being able to sort of get access. And the other thing that we do is that we use something called the one-time PIN authentication method. So anytime that you sign into the platform or you sign up, we send a code to your phone that you can enter that would sort of verify that you're actually the one that entered the details on the platform. And in order to sort of authenticate any kind of transaction, whether it's group or it's a personal transaction, you have to use your PIN. It's something we call the Bezo PIN. So you enter that to sort of authorize that the thing should actually go through. So I would say we're using some of the measures that are being used by existing financial institutions like banks to make sure that the platform is well secured. Aside that, just like I mentioned, the deposits are being held by the banks, and also the movement of the money on the platform is being carried out by a payment processor. And these are trusted partners that are being used by some of the major mobile money operators in the country.
Thank you very much. Yani Chuku, it's a double question as well. It's coming from Bashir Yusuf. He says, what are the plans for post-COVID for eHealth? Then secondly, what can eHealth contribute using their technology to health sector in Africa, as well as build capacity of health workers? Thank you, Bashir, for that question.
Okay. Sorry, we just had the power outage, so it's a bit dark in my background. Okay. Post-COVID, what eHealth is looking at is pushing a whole lot of focus on digital approach to health system management. So you see where a whole lot of paperwork is being done in medical facilities. You see someone not being able to have his record accessible from another government health facility if he's attending sessions in one health facility. So what we would be pushing a lot post-COVID-19 is a lot of use around digital systems, around data management, because for proper planning for this response, both on the government side, a whole lot of data is actually important. Now, you want to provide palliative for people. The question would be, what data are you using to determine who you're actually providing that? So we had actually implemented some systems before, supported implementation of a few systems. One of such was the Grid 3 project, which provides demographic data available for different states in the country. We've also developed a robust geo database of various points of interest all across Nigeria. So this data we would, as much as possible, begin to push for governments, for private organizations to have access to those and to be able to use them. Now, one of the things we've actually built around the system over time is an open source methodology for development of everything we do, because we know this is Africa, and someone would come up with a statement of inability to manage the system because of license issues. So we've built a lot of what we've built around open source systems, and we hope that this would be sustainable for governments to manage. to possibly the lowest administrative layer of the government system. For building of capacity of health workers, I had already mentioned the academy and the e-learning platforms that we're actually putting out there. So we'll do a whole lot about engagements for trainings and capacity building for health workers, because we noticed that as a very huge gap during this response to the COVID-19. So a whole lot of push for the use of data, a whole lot of push for use of geospatial data for key decision making by both government agencies, by key decision makers, not just in health, but in agriculture, in logistics, and in supporting different ventures, as the case may be. I hope I was able to address this question.
Thank you. Yes. So I was also looking at some other questions that are coming as well from here. I don't think the second part of the question, in which he was talking to contribute using their technology to health sector, as well as build capacity for health workers, in terms of capacitating health workers. We can't hear you.
Oh, sorry, my mic was on mute. So,
okay.
So what we would do with building capacity for health workers would be largely to carry out field level capacity building. Currently, we are working on a capacity building plan targeted basically for building capacity of government workers, especially those that are working in health facilities or providing one form of service or the other in the health system strengthening plans in Nigeria. So we will do a whole lot of capacity building with the use of data and technology. We do a lot of capacity building around how to use geographical information systems, for example, and how to translate a whole lot of paper-based activities that we have largely in use to digital formats. We believe strongly that with this data available, it will be easier for decisions to be made quickly and actions to be taken quickly by health workers. Just to buttress this point, one of the things we supported in Sierra Leone was an electronic disease surveillance system, which actually helped with response. And I think that's actually been used in part of the response now. So we supported that development. We handed over that project in Sierra Leone. We also supported the Avada project hosted by WHO. It's actually audiovisual system for managing surveillance for polio. So these are the kind of things we would continue to push for capacity building among health workers. And we hope one of the things we've tried to clear is most people would say, are we sure that they are able to use this technology? And I say, if a health worker has an Android device, then he can use the simplest technology he can find there on the Android device to be able to do what he needs to do. Yeah.
Powerful. If you have an Android device, you just need an Android device and you can be able to do your work properly. This is great news. We have a question from Masimba. He says, are your solutions 100% homegrown, or you also leverage open source technology? Mbarak, maybe.
Yeah, I think for us, our solution is mainly homegrown. So we actually built it from scratch, but then we're sort of leveraging off of third parties to facilitate certain important transactions on the platform. It's actually built on SSD. The full meaning is unstructured supplementary service data. So it's like SMS, but then it runs on a session, and then you get prompts anytime you enter something, and then there's like a next prompt, and then you can go through that to actually go through with whatever you're trying to do. And that is actually being provided by a third party in Ghana. And we're also using an SMS to send out various forms of sort of notification to the users. We're also using a payment processor, which is also in Ghana, but the platform itself was built from scratch by us.
Okay, thank you. Yeah. There's another question. The questions are coming thick and fast. This is one that's from Moses. He says, "Is Africa prepared for post-COVID crisis? How would the two sectors, fintech and technology data, assist potential COVID crisis?" Yeah, this one is putting you guys on the spot. So we start with fintech, then we go to technology.
Yeah, okay. So I mean, even during this time, people are seeing the importance of fintech platforms, especially payments platforms. There are people that are locked up in their rooms and they need to buy things. Some need to buy them online. So in order to pay for the things, they actually need to use a payment gateway uh, to 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 actually do that. There are people that are also very far apart from each other. They are kids in the cities, and some have their parents in the villages. They need to send money back home. It's the same payment platforms that they use to send this money. So I think people have actually seen the importance of having sort of fintech platforms, not just having banks. So I mean, even from now, you can clearly see it. And in terms of being prepared for the COVID crisis, I think that one part of the preparation actually for the
Sorry,
government. Oh, post-COVID,
sorry,
okay.
for the post-COVID, yeah,
Okay.
after COVID is finished. Yeah.
Yes. So I think one part of the workforce on the government, so they need to put in place the necessary frameworks and also the regulatory sort of things that are that are needed by these fintech companies to sort of help them to be able to thrive. So the governments need to put a lot of focus on creating these sort of structures, and also, if possible, finding ways to actually provide funding for these fintech companies, for the ones that are very early stage or the ones that are looking to grow. And then the other part is actually on us. So like I was saying before, the current pandemic, or current, I don't know, like the crisis has really made an impression on people for certain services. And like I said before, savings is very important, investment is very important, and also being able to insure yourself or your family. These things have become very, very important. So after everything dies down, after everything passes out, people are going to start rushing towards these types of services. And so I think that if you are someone who is in the fintech industry that is out there, you might want to look into these things. And if you're also someone that is looking to come into the field, you might also want to look at them. And I think one thing that I'd like to say is that the thing about fintech is that it could be integrated with various platforms or various sectors, right? Wherever there's movement of money, fintech have a role to play, right? So I mean, I would even go back to the eHealth platform that is being built by Yanuchuku. Something like that. People need to pay for the services that they actually enjoy on the platform, and the only way to facilitate that movement when a person is sitting at home or when a person is not close to you is to use financial technology. Yeah.
Thank you. Thank you for connecting eHealth to BezoMoney quickly. That's what an entrepreneur does. So over to you, Yani Chuku. Is technology data prepared for the post-COVID crisis, and how can this be, and how can technology and data also assist in the potential post-COVID crisis?
Okay, so I was going to start off from where he ended, to say even in health
Yeah.
systems, fintech is key. You would want to buy commodities and have them in store for your health services. You have to pay for them. You can't move cash as much as possible anymore physically. So the easiest way to do is to use technology to do that. Now, most of what we use or we would use post COVID-19 would have to be data-driven decision making. You want to provide new financial support or palliative to SMEs, to small businesses. The question is, where are they located? How many are they? This is all data, and you need to have this data readily available to be able to make this kind of decision. So you could see a whole lot of use for importance for geographic information systems coming into play also, where you don't just want to know where who will need this support. You want to know where they are also located. So you want to have equitable distribution of support post COVID-19, for example. You want to have schools be able to know where their students are, to be able to also provide e-learning to students, especially in cases where they can't come physically to school. I've seen a whole lot of schools, for example, switching to online course modules. I've seen a lot of religious organizations having their programs, and they have to be able to. Some of them are interested in checking that people are actually connecting to these services, for example. So this is all data driven. And I want to think we have learned the hard way, but we were not completely unprepared. But what we would need to do is to begin to learn how to use what we have, build on it, and focus a lot on homegrown solutions. And for me, we at eHealth, we drive a whole lot for open source systems. So a lot of collaboration with third parties, a lot of collaboration with systems out there to make it easily accessible to people. So because one of the things you would have with technology that may be discouraging for people to use is if the financial implication or cost for using such becomes a burden. So like Mubarak had said, the government has to do a lot. What we need to do on our part is a whole lot of awareness and communication out there to make people understand that life may not be as it used to be before. So we need to begin to learn how to use technology. One of the things I see that may begin to come up a whole lot more with maybe telemedicine, where I probably don't need to drive to a health facility if my symptoms are not so serious, but I can get advice from a doctor no matter where he is. And this affords us the opportunity to connect to medical practitioners, even outside Nigeria. I could probably connect to one in Egypt or connect to one in Sierra Leone, as the case may be. So these are the things I think Africa would be able to do. And are we ready? I would want to give us a score of 50 because I know we have something. We have the human resource, we have the knowledge, we have the capacity. It's just to be able to put that into good use. Look around, a lot of things are actually happening in Nigeria, in Africa actually during this process, and I think we can build on that. The data is out there. We could work with that, and we could do well post COVID-19.
Thank you very much for that very optimistic post-COVID look in terms of Africa. You gave us 50, give us 60 or 70. Okay, guys, there are a lot of questions, but we are running out of time. There's another last question. Okay, I'll say Sam as he says, thank you for addressing the point of payment gateway. Our people are very reluctant to use payment gateway. This is unfortunate. That is the most secure and dependent, and it is the future of e-commerce. We must educate small business. This is for you, Mubarak. Otherwise, they will not access global markets. Thank you very much, Sam, on that. I'll also connect you, Mubarak, to Sam as well. They have an organization called Comesa out of South Africa, a lot of small business enterprises. Maybe you might also collaborate there. This last question, and this is my last question. I know we're running out of time, only have 2 minutes, and this one goes again to you, Yani Chuku. Moses says, based on the current data gathered, would you say COVID, he says COVID-10, but I think you want to say 19, may have had a positive short-term impact on Africa in relation to digitalization and technology? Okay, yeah.
So I think yes, there's a positive short-term impact which we can actually make long-term. Reasons being that you could see that services are becoming more digital now. People are beginning to get very attached now. Yeah. So one of the things I had jokingly said to someone is, when we say social distancing, in real sense, we've actually made people come closer on the social platforms than just physical activity. So what we needed a whole lot more. The message out there was actually physical distancing, but socially through technology, through digital means, we've been able to get people closer this period. And I think both education, both health, both fintech, agriculture services, you see people wanting to order food, and you could actually, rather than go to a restaurant, you can have it delivered by simply pushing a button on your phone. So I think it's actually the COVID-19 and the data we see going out there. It's actually more on the positive side, with people getting closer to technology, getting closer to digital systems than what we have been used to all this while. I had a conversation with a friend today that said they've been in existence for years, they've been doing consultancy, but they've never really pushed anything online. But now they're actually scrambling to make sure everything goes online. So businesses are beginning to learn how to go digital. Businesses are beginning to learn how to use technology. And I think it's a positive impact, which we can actually stretch and see how we can sustain that in Africa.
Thank you very much. Gentlemen, we've run out of time. It was very exciting having you on the show. Barak in Ghana, thank you once again. I want to connect you to Comensa, but I've already connected you to eHealth. That is what Afrolynk does. We are a bridge in terms of getting synergies and getting people together. To Iana Chuku, thank you very much from Nigeria, eHealth. Again, we say we want to see more eHealth on the continent. But what you guys are doing is very great work. So thank you, both of you, for coming. To the viewers, thank you for tuning in to another episode of Afrolynk Expert Live. Cheers.
Thank you. Bye.
All right.
Okay.